So what can we do to actually safeguard our antibiotics to preserve these for future use? What options have we got?
So I guess one of the main things is if you can condense this massive subject into one kind of phrase, it's using them when they're indicated, not just in case. So it's using antibiotics at the right time for the right condition for the right duration. If we need to do studies to identify whether if you've got a condition where you typically prescribe 2 weeks, whether five days would be sufficient, and very, very well maybe. So I mean, essentially, it's trying to use our clinical skills to minimise the requirement of these drugs, but also it's becoming I guess it's one of the important things really is becoming comfortable with a less belts and braces approach, throwing the kitchen sink. If you've got a patient and you're not sure of the diagnosis, we need to ensure that antibiotics are indicated. Ideally you want to do a culture or factors like that, but also I guess recognising that you can minimise the use of antibiotics within good infection control. So good surgical sterility, good wound hygiene after the operation.
Hand hygiene?
Hand hygiene as well. These are all things that we're very familiar with now because of a certain virus. So it's using those, that knowledge, those skills, that resource, that insight to recognise that antibiotics aren't always needed. And by reducing the amount we use, we will reduce the selection pressure on bacteria to develop resistance.
So if you're a vet in practice, and I'm an anaesthetist, so it's a long time since I've been in that situation making those decisions, for specific indications, where are the resources to help you choose the right antibiotic?
So, I mean, there's a huge, compared to 10 years ago now, there's lots of resources. Obviously, I was involved with the BSAVA Protects Me scheme, which is now freely online and available, but there is other guidelines from RUMA. There's ISCAID guidelines on urinary tract infections and dermatological infections. So there's a huge amount of resources. But one of the keys really is having these active discussions within your practice. The best way I can kind of describe the strategy for this kind of thing is very similar to waste and greenhouse gases, in that it's everybody in it together, everybody having a similar approach and similar strategy. If you're one person who's managing their antibiotics, but then everybody else is prescribing loads, your effect will be diluted. So it's having those discussions with your colleagues and making people feel comfortable with, like I say, not over prescribing just in case. Patients will sometimes get infections post-operatively, but they may happen anyway, even if you prescribe antibiotics. And we need to accept that. There are some where it's very high risk, CNS and implants and things like that. But in other situations, ensuring, if it's a clean operation, you may not necessarily need to use them. There are routine situations like acute diarrhea and things like that where they're not indicated. I mean, you and I would never think about phoning up the doctor asking for antibiotics after a dodgy takeaway. We just wouldn't. So, yet we have owners who present animals with that situation and they're not indicated because it's a self-limiting, self-resolving condition.
So how do non-prescription pads fit into that situation?
So the non-prescription pads, I love the ethos and the idea behind it, because it's essentially recognising that moment in the consult room when you've got owners who have previously been prescribed antibiotics for a condition that it's not indicated. And if you've got somebody who's always come to the practice for the last 10 years, always had antibiotics for a diarrhea or a kennel cough, they will expect that, and that will be a challenging situation, particularly on a difficult, stressful day. So the non-prescription pads, I guess, are, we hope are a way of assisting that conversation, between the vet and the owner. So you can give the owner the prescription pad and say, look, it's not just me, this organisation's agree with me that it's not indicated, but it also has advice. So because they will worry by not having them, there may be a problem. So you can list advice of, give us a call back if this develops, or if the clinical signs haven't resolved within a few days. So they go away with an advice sheet to use so that they know when to call you when you haven't prescribed the antibiotics.